The Honourable Speaker, sir, the Honourable Prime Minister, the Honourable Attorney General and Minister for Economy, Honourable Cabinet Ministers, Honourable Assistant Ministers, the Honourable Leader of the Opposition, Honourable Members of Parliament, members of the public in the gallery, and those watching this proceedings from the comfort of their homes and offices, a very good day. Mr. Speaker, sir, I rise to respond to the 2022-2023 National Budget announcement delivered by the Attorney General and Minister for Economy, Honourable Ayaz Syed Qayyum, on Friday, the 15th of July, 2022. Mr. Speaker, sir, the 2022-2023 National Budget is an innovative and forward-looking budget that is going to pave the way for the Ministry of Health and Medical Services to re-establish itself and refocus on the challenges ahead with a vision to consolidate and expand its service with appropriate reach and coverage. Most importantly, it will enable the Ministry to assist and facilitate the nation's objectives of building back stronger and better. The allocation of $395.1 million for the Ministry of Health and Medical Services budget provides the needed space that the Ministry requires to recuperate fully from the impact of the global COVID-19 pandemic, which has not spared any sector in this nation and set in motion a series of actions and initiatives that will shape the future of health services in Fiji. Mr. Speaker, sir, our experience from the last 28 months of the pandemic has clearly shown us the potential in the private health sector and the role it can play working hand in hand with the public sector to deliver quality health service to the people of Fiji. The government's innovation of engaging private general practitioners has greatly increased the accessibility of health services to the ordinary Fijians and has allowed for people to be able to get free health consultation at their local participating GP instead of having to travel great distances and expend a considerable amount of their time and money to access the health services they need. With the success of this new approach, the government has now increased the allocation under this budget to be able to engage more GPs in this scheme. In addition, government has also extended this engagement to include private dental practitioners who will also be able to attend to members of the public, for which government will foot the consultation bill. With this government support, members of the public will be able to access 6 additional new free services selected by government under the scheme, and these are multi-urine dipstick to test for various chronic diseases, electrocardiogram or ECG for those with chest pains, nebulizer for treatment of asthma, oxygen treatment for those requiring oxygen, an ultrasound scan investigation for those needing this non-invasive test, and the blood sugar level pinprick tests, which are some of the most sought-after services in our hospitals and health centers. Renal, kidney, and liver functional tests, including full blood count tests, will also be available through this scheme. Mr. Speaker, sir, these are the 6 common tests that people generally come to health facilities for, and hence the greater availability of these tests means the timely availability of test results for better management of their health complaints and the reduction in time spent at the health facility. Government's allocations towards the DP scheme and the dental practitioners scheme will surely ease the burden on public medical facilities. And most importantly, it means that our people do not have to wait in long lines at hospitals and health centers to access health services in a timely manner. The scheme can only be described as a win-win arrangement for both patients and participating GPs and dental practitioners, as it also provides an excellent opportunity for the GPs and private dental practitioners to grow their patient base as they contribute towards the provision of necessary health care for all Fijians. Mr. Speaker, sir, in this new budget, GPs and private dental practitioners will be able to prescribe and dispense 24 hours worth of medicines for their patients. This will assist patients seen after normal working hours when pharmacies are closed and the medicines are needed to provide immediate relief for their illnesses. This arrangement will help people to get the treatment they need immediately within the 24 hours and later get the rest of their medication when pharmacies open in the next day. The penalties in place will be a deterrent for those who intentionally wish to exploit this provision beyond its intended scope. In addition to government's efforts to improve and expand its services, government will continue to engage the approved 7 private medical laboratories for laboratory analysis and blood samples referred by GPs engaged under the free GP scheme. Mr. Speaker, sir, government's initiatives to support GPs in setting up their clinics in rural areas such as Nawai-Dhomba, Malolo, Naidovi, Drasa, Sambeto, Siaganga, Riketi, Nasarawanga, Koralevu, and Pacific Harbour is a commendable one. With the allocation of $200,000, GPs would be in a good position to establish themselves in these rural locations and deliver much-needed health service to these communities. The initiative augurs well with the FijiFirst government's dream of decentralizing and expanding its health services even to the rural, remote corners of this country, so that no one is left behind in accessing essential health care. We can only encourage GPs to take up this offer and assist in extending the scope of their specialist care into rural areas. Mr. Speaker, sir, in this era of sophisticated medical technological advancement, outsourcing of medical testing is a way of ensuring better access to sophisticated technical investigations in a timely manner. Outsourcing of testing modalities during emergencies such as X-ray, MRI scan, CT scan tests, and ultrasound scanning helps to build capacity in private health facilities, thereby building resilience into the testing capacity of the health system, in addition to sharing the load that the public health facilities face each day. Overall, this initiative reduces the cost of to the general public and improves the equipment performance and longevity, and most importantly, exponentially increase service levels to the members of the public. Globally, it has been shown that with outsourcing of health service can provide important benefits to payers and consumers, and they include improving health results through the new program offerings, reduced medical costs brought about by reduced operational costs, cost savings are reinvested to finance new products and services, increasing customer base through consistent outreach services, improving consumer satisfaction, positioning for growth or expansion activities aimed at improving services, overcoming barriers like time zones with a workforce that provides a 24/7 service. The selection of the participating private health providers will be determined through a clear, transparent process, including standard operating procedures. Mr. Speaker, sir, the government has also committed to continue to deliver specialist health care for those who need them in the new financial year. A total of $2.25 million has been allocated to the ministry and distributed to the three main referral hospitals at CDLM Hospital, Lautoka Hospital, and Lambasa Hospitals for the emergency evacuation of patients to these hospitals. This means that any patient from anywhere in Fiji can be evacuated to one of these three hospitals if they need urgent high-level medical care for their conditions. This allocation ensures the equitable availability of high-level health care to all Fijians, irrespective of their social or geographical location in Fiji. Government is allocating $1.5 million to subsidize kidney dialysis treatment, providing a subsidy of $150 per dialysis session for patients whose total household income is less than $30,000 per year. These sessions can be taken at the dialysis unit nearest to them, and patients will be required to cater for the costs above the subsidy amount. Since its inception, this scheme has proven to be very successful, with those who could not afford treatment in the past now able to access the treatment that they need. In addition to the high-level specialist care provided in our health facilities, patients can also access specialist health care that we cannot offer in Fiji through the ministry's overseas treatment scheme. Government has allocated $1.5 million that will ensure that definitive treatment for those who need overseas treatment will be made more accessible now more than ever. Mr. Speaker, sir, three major capital projects earmarked for the ministry for the new financial year with a total of $5.2 million. This includes the refurbishment of the Savu Savu Hospital, the interior upgrade works for Lambasa Hospital, and the commencement of construction of the new maternity hospital at the Colonial War Memorial Hospital in Suva. Work on these projects have been hindered by the pandemic, as these hospitals were also required for the COVID-19 response. The refurbishment work, once completed, will help not to only provide a fresh look to these facilities, but also build resilience into these critical health infrastructure in times of disasters and health emergency responses. Mr. Speaker, sir, human resources remains at the core of health services anywhere, and Fiji is no different. In Fiji, nurses represent the majority of healthcare workers by far in the ministry. However, the turnover of nurses continue to challenge the ministry, and we cannot deny the high demand that exists for our well-trained and highly competent nurses from overseas countries such as Australia, New Zealand, the United Kingdom, and the United Arab Emirates. We are continuing to train young and upcoming nurses at our nurses training institutions to meet these needs. Currently, our three nursing stations have a total, nursing institutions have a total of 235 student nurses who are expected to join the nursing profession by the end of this year. Once engaged, this will bring the total number of nurses we employ in the ministry to 3,267, giving us a ratio of one nurse for every 271 Fijians. Mr. Speaker, sir, in addressing this need, the ministry is working with the Fiji Nursing Council to identify the additional specialized areas of nursing to allow specialization for nurses with the required skills and competencies who will be recognized and remunerated accordingly. The allocation of overtime allowance and rural maritime allowance is an appropriate acknowledgement of the nurses' dedication and passion, and will also provide an added incentive for the nurses to continue to deliver quality health service to our people. Government's move in providing for a transport allowance for public health care nurses in the rural areas is highly commendable, considering the difficulties that they often face to reach out to Fijians in the rural and remote corners of the country. The scarcity of trained and qualified midwives remain a challenge for the ministry, and the provision of more training opportunities and appropriate remunerations will help in addressing the need we have in this area of expertise. Mr. Speaker, sir, I have stated earlier and wish to reiterate that the new budget is an innovative one for the ministry. The government is taking great steps in engaging the private health sector into the health services for all Fijians. The new budget has also provided allocations for the engagement of NGOs in providing services that support and complement the service that the ministry is delivering to its people. The COVID-19 pandemic has taught us that cooperation and collaboration is the key for any successful service or program, and health service provision is no exception. We need to work together to build Fiji back better and stronger, and I encourage all health stakeholders to take advantage of the opportunities that the government is providing in the proposed new budget 2022-2023. With this, I fully support the proposed budget before the House, and I thank you, sir.